Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera. Very good day to you. Firstly, may I congratulate the organizing committee chaired by Dr. Arina Anis Azlan for the successful International Postgraduate Research Conference. May I also thank to all of you for the kind invitation to discuss about research challenges in COVID-19 pandemic crisis. This is my disclosures. I have no actual or potential conflict of interest in relation to this presentation. The main thing I would like to cover today with all of you is the type of research affected by pandemic, the challenges in clinical research, in laboratory and community researchers, as well as social sciences, and how to overcome these issues. These are the typical anatomy of the virus. You can see here encoded enclosed the RNA protein, multiple spike protein, and lipid membranes that really give a life lesson to all of us globally, and how a very small 10 micrometer or 10 nanometers, in fact, this virus can do to us in all over the world. If you look at the pandemic situation in Malaysia, if you look at step back and do some reflections since early last year, there are many episodes of movement control orders that ordered by the government, leading to a lot of issues and losses to employment, so and so, until the end of the year or August, when we have the recovery movement control orders, and this certainly affect many of us, students, lecturers, in fact, all human beings, not only in Malaysia, but we all know also globally. Again, in comparison, this is the coronavirus, 0.1 micrometer. If you compare to our red blood cells, it's this size. It's a very small virus, but the impact given to the humans are massive. Now, a little bit glance to beginning in end of 2019 in Wuhan, in China, where subsequently WHO declares the COVID-19 outbreak in March 2020. And as of mid-November this year, you can see over 250 million people got affected, over 5 million mortality, and certainly in Malaysia, over 2.5 million got infected with COVID of different categories, and to now is nearly 30,000 over died of the COVID-19 infection. And if you look at the economic and healthcare burdens of the not only COVID, also long COVID-19, 2.4 billion ringgit losses per day during the movement control orders, and a lot of loss of the productivities due to the health-related issues. 18% no longer working, 90% change of work status, and a lot of them, 73%, managed to return to work after 6 months recovery from the pandemic, and we still are in the era of pandemic at this moment of time. So the COVID-19 impact on the tertiary education sector in Malaysia, as simple as that, universities have shut down most scientific research activities during the period of time. So we have done some questionnaires. How has COVID-19 affected your research? 15% said very little. I was conducting research online already. Lucky for this group of researchers. I moved all my experiments to online. Interesting how they don't move that. I moved some of my experiments to online platform and stop others, 29%, and 13% claim that not at all. I am not in the data collection phase. Very lucky individual who just finished probably data collection analysis pre-COVID. 16%, I have to stop all my research activities, and very small, I do not have a research. So these are among the questions that have been asked to the researchers and how they experience with COVID-19. If you look at the research has focused, the focus initially for something else, could be non-COVID, has shifted to COVID-19. And if you look at this comment by Professor Richard Horton from the Lancet, COVID-19 related research almost monopolized the publication focus to the detriment of other topics that editorial team has actually planned to do before. And all this redirection of the research COVID-19 towards the consequences for physical, cognitive, and psychological health, vaccine and treatment, as well as the rehabilitation. If you look at these shifting goalposts, research in the time of coronavirus. Certainly, this pandemic has turned life, travels, and many other aspects of life, including economy, upside down all over the world. But what impact has it had on research and research practice too, like us academicians, students, industries, and many other sectors that we can discuss today? So what about the impact of COVID-19 on the clinical research where I'm coming from? So if you look at how the pandemic impacted clinical trials, these surveys by Fierce Biotech, 41% of trials were delayed or put on hold because of the pandemic. 41% of these delayed trials will now run this year, significant delay. 65% of the life sciences sector say they will continue to run trials remotely after the pandemic. These are involved trials who not involving the hands-on procedures, can be done by interview, for example. 57% of the life sciences organizations say the cost of running a trial has increased since pandemic for other issues. And 49% of life sciences organizations say the time to compare a clinical trial, complete clinical trial, has increased dramatically since the beginning of the COVID-19 pandemic. So I think the challenges in conducting clinical trials, myself as part of the trialists, are many in terms of healthcare professional committed to other critical tasks that we are part of the frontliners to help the patient, and sometimes we got infected, has to undergo a self-isolation quarantine, monitoring patients or staff virtually, patient hesitancy or difficulty access to hospital and travel limitation because of the issues of the COVID-19, and also interruptions in the supply chain for the investigational product we have to take from Europe, for example. So these are the issues, challenges in the clinical trials. So the main obstacles are exposure to infected patients, how the patient come to the hospital involving trial pose extra risk for them, the lack of power of study due to the dropout due to COVID, a poorly design of clinical trials, maybe to suit the need for the COVID-related issues, and ethical approval, because the ethical committee has to understand about the speed up process to use because of the COVID, and urge to publish and share the new fundings leading to fast-track peer reviews, for example, and competition for resources among different projects, and the need for development of vaccines or therapeutic properties for combating COVID-19 infection. And of course, emotional pressures on researchers also are the main obstacles for this COVID-19 pandemic. So the impact of the pandemic on ongoing research are many. The career, for example, physician scientists have been shifted toward from research to the patient care. A lot of time given to the critical care, which is very important. To encourage research, the NIH has provided guidance on the proposal submission and award management. So timeline to be relaxed and grant personnel to be paid. And of course, the long-term impact of research obstruction should be in place among the important things to do. So the FDA guidance on the conduct of the trials on the medical product, for example, during COVID-19 pandemic, COVID-19 screening is mandatory to do. There are protocol deviation amendment because of the difficulty of patient to reach us. We miscapture all important visit changes in schedules or patient drop out. And of course, decision whether to suspend very, very difficult or to even start the trials at the end or the beginning of 2020. So role of the institutional review board in terms of ethical approval is very important. Revising and reviewing the policies and procedure to adapt the current changes also need to be done. Acceptance risk and benefit ratios, the safety of all personnel is paramount. The research assistant, the lecturers who go to the field to recruit the patients is very important. Extension of the study should be allowed. I think we are glad that Ministry of Higher Education give extension to many grant holders. A review of the process that increases the speed of the recruitment for ethical approval should be done. So if you look at the many ongoing, even non-COVID related trials in terms of adaptation, preparation, implementation has been affected by the COVID-19, whatever the approach or the content of the studies or protocol, these are really disrupted during the COVID-19 pandemic. And the COVID-19 has changed the culture of science, believe me or not. The new norm changing to the electronic consents, remote monitoring or assessments, or mailing investigation and medication to patient by drive-through or by delivery to patients, a web-based telehealth consultation, rapid digitalization of clinical research, and of course, virtual management of trial. These also involve the ethical approval before conducting the new norm of the clinical trial research. Again, typically any vaccination that to develop takes about many years, 10 to 15 years or so, but this COVID-19 is special. And to date, hundreds of vaccine in development, 8 in trials. I think we all know what vaccine that we have received so far. In terms of long-term effectiveness is still clearly unknown, but clearly the best vaccine so far is the one that we get fastest to confer some protection to ourselves from the infection. What about the impact of COVID pandemic to lab-based research? I think there are unequal effects of COVID-19 pandemic on scientists. Female scientists have 5% decline research time. The female scientist with at least 5 years old child or younger experience 17% decline in research time. And of course, change in the home life due to school closing, social pressure unique to gender. And I just interviewed my staff here in Dean's office. The ladies who get small children prefer to be working in the office rather than at home to minimize the disruptions at home. So we do some questionnaires to our scientists, 138 scientists who use lab to generate data, and significantly shows majority of them, 77%, to change from the wet lab to the dry lab using many platforms or the computational methods. And of course, nearly 75% of them required to stop working completely because the lab is completely closed. Lab research also need to follow the general laboratory safety practices. Site-specific and risk assessment must be done, and the personnel or students must be fully vaccinated, wearing appropriate gears to prevent any infections. And those who are not fully vaccinated at that time last year, they have to wear the mask, they have to physically distance from other people about 6 feet or so, and analyze. The numbers are be very limited, and the flow is really a one-way traffic in the laboratory for people to maneuver any experiments. And we also have to assess procedure for clean and sanitizing that commonly used in the laboratory of any equipment, and step to help to prevent the spread of infections, really a routine practice. And anyone who are sick rarely have to stay at home, and sometimes can disturb change of flows of any laboratory-based steps. And the personal hygiene, disinfections, space, individual has a bigger space than usual. Staggering work depending on the size of lab that you have in your department or universities. They has to look after quite well, and some tasks or experiments may be very limited. So the researcher or the student really have to discuss very closely supervisors in terms of conducting that research. And again, I'm not going to reiterate here, it's quite important. Regular hand washing, regular using of personal protective equipment if necessary, not sharing the white coat in these lab, using equipment or something that really is sterile, and work schedule if physical distancing is not possible, and in the setting of limited resources, sharing infrastructures must have a mechanism how the booking taking place for students, not to mingle around with many of them at the one time. So continue working remotely is very important to be effective, and also to ensure the potential exposure to COVID-19 is reduced. How we adjust the workplace, engineering, smart engineering controls, a reduction of the exposure to COVID-19 had to really look very carefully. How we redesign, remodify the workplace. The concept of work from home is something that new that we have to adapt at this moment of time. And how we adjust the work processes, including administrative controls, implementing screening or hand hygiene practices, administrative processes. In other words, COVID-19 made people's life difficult, but whether we like it or not, we have to follow all these procedures, because at this moment of time, all sectors has to practice, health sectors element inside it, regardless whether tourism, economy, or many other sectors. What about the impact of COVID-19 to community-based research? Well, the high person-to-person infection patterns of COVID we have observed, data collectors of the student or research system goes to the community will have exposure to the public health risks. And in the context of global pandemic, we do ask ourselves, does our research still keep people safe? And we know that the amount of COVID-19 virus happen in different secretion, but mostly that we know that from saliva, from the mucus, and from the throat, that is important while all of us has to wear this mask and protective personal equipment. And also in the stool, somebody got diarrhea, also can have exposure to other people. So personal hygiene has to be enhanced in order for us to minimize the COVID-19 infection. So the impacts delay to care in vulnerable population and fragile health system, a decision to seek care also because give rise to the lack of trust in the healthcare system, a lack of knowledge, attitude, and practice toward health issues, the wide-scale testing for the certain community members, they are unsure about the health status and accessibility to the healthcare costs in terms of the logistic issues, high costs and lack of transportation options, also an issues for the community-based project for research assistants and researchers who are involved in this. So the challenges are many in terms of issues of contact, level of contact with participants can be varies. The new area, we have to identify community mobilizers via initial face-to-face contact, for example. Consent can be done remotely, and oral consent must sometimes can be recorded. So the funding may be also an issue, additional budget for transportations, for extra other things that to be done, less carpooling to go to the field to recruitment, so and so will affect the amount of money to be top up in order for community-based research to be conducted. And traveling, of course, border closed. Those who are doing interstate research also be affecting, unable to attend many conference workshops at this norm in this era. And preparedness and readiness in terms of capacity strengthening, buildings, scenario planning, infrastructure, so and so, actually not in place at that time. So we really have to adapt and adopt very quickly for this COVID-19 pandemic. So the way forward should be have a disaster preparedness, how we respond to disasters, how we have resilient toward the mindset, how to overcome these obstacles. We really have to be a problem solver type of individual rather than problem creator in order for any type of research, clinical, laboratory, community to move forward. And we have the highest priority goals are treatment and prevention, and we have to restore really economic and the social welfare pretty much faster with the limited scientifically robust data, but small data, which is very novel, can still publish in the high impact journal. Now, if you look at the social science research during pandemic, you can see here very nice metrics in many aspects among the top research field. Of course, in public health literacy and education, telemedicine or telehealth or teleconsultations, mental health psychology. I'm sure a lot of social sciences champion these, social media intervention with infodemic, physical activities, and also a different cohort like prison reform. Now, if you look very closely, the era of COVID-19 research, and to date, since 2020, 142,000 articles has appeared in many journals. To translate into per day, around 389 articles being published per 24 hours, which is equal to one article for 4 minutes. Every 4 minutes, one article being published. This is, you can say, amazing work, but one's also wonder about the quality of the articles of work being published in reputable journals with a fast-track peer review or without peer review, because this COVID-19, nobody knows in great details at the moment of time. And most articles are glad that I think you guys in the social sciences are great. This is actually the crisis that you change to the opportunities. Most articles are concerned not directly with the medical outcomes, but rather about how the COVID-19 impacts on the social behavior and, of course, economic outcomes. And there are growing numbers of articles now on also on the financials, on the investment, social, political, and many other aspects of the social life. Now, so as I said to you early on, is a really a crisis that some others, subspecialty, in particular social sciences, can easily turn this into opportunity. Research pointers in social sciences find nowadays it's still not late to find the potential national, international collaborators. Please identify the gaps in the research and how this COVID-19 impacts on many issues, not only related to the treatment and vaccination, but importantly to finance, microeconomics, social policies, or tourism, employment. What is the policy for the working from home? Nobody knows. So come up with the data on how the work practice to be done as a work from home at the national level. Any government has no idea about what are the policy to be effective in terms of work from home, and also corresponding solution urgently required to solve many potential issues that arises even after pandemic subsided. So the COVID-19 pandemic as a natural experiment, where many studies has been performed at the interactive time series, where during the MCOs, which is attributable to the pandemic, and noting that the pandemic changed support for institutional disrupted patterns of the crime cyclicality. So researchers also cannot expect that the future event, let's say in 2025, that will not be the same like we experience now, and this pandemic could be performed like a pure replication. So we really have to be waiting maybe another 50 to 100 years time to get another pandemic. God knows what's the name. So we can compare how this pandemic affect people. I think none of us in this generation live in the 1920s, maybe some lucky ones still experienced a Spanish flu, and how at that time these many aspects, socioeconomic factors has been impacted very badly. So COVID-19 pandemic also, in terms of natural experiment, a question that I pose to all of you today is, will the habits of social or physical distancing persist after pandemic wanes? Will the leisure habit adopted during lockdown influence how people's or population, not only in Malaysia or globally, thinks about health and well-being for the long term? Will household division or labor induced by school or university closures affect gender inequality in many decades to come? And for your information, will the post-COVID-19 syndrome, in other words, those who develop COVID, they've developed syndrome, will also potentially can affect many aspects in the socioeconomic in the future of the affected patients. So for your information, the long COVID-19, also known as a post-COVID-19 syndrome of PACS, define symptom and sign that they develop at the end or after the infection with COVID, could be continue for weeks and months, and I certainly start to see in my clinical practice now, and they are actually diagnosis of occlusion, not well explained at the moment, but certainly they can affect many other aspects of our lives in the future, something that all of you can take opportunity to recruit these participants or the patients who different category for the future studies. Pathologically, this affecting us in the protein or chemokine that involved in the inflammatory process during infection, thought to develop this post-acute COVID-19 syndrome that no one knows at the moment of time. So the lesson that from the era of COVID research at this moment of time, we do not yet know what are the long-term follow-up would be of interest. So we should really preserve the details of the records of the patient that we study now, what is going on from now for comparison in the future. With only a modest coordination, I mean, some clinic has the follow-up post-effective COVID-19 infection patient, what the government agencies, universities could curate the data that can be used for many other aspects and manage the pandemic so that the future generation of researchers can use them. and in the ethically sound ways, and to understand the scale of pandemic affecting from last year and the next many years, what actually the implications and how they can replicate relevant work in the future. In other words, this current generation who experience these bizarre or peculiar times of pandemic, where we can see in the hospital real life the dead bodies all over the place, what are the mental or non-mental or many other implications that are relevant to these people. And also the new normal dressing code for virtual meeting. I'm sure for the guys, if you are working at home, you probably put it nicely on the upper part of your bodies and to continue doing a meeting, whatever that you have to do. Also give another ethical issues, what will be the most appropriate dressing code when we do a virtual meeting. And people have a stress. This is, for example, my management team, the Faculty of Medicine, and until now, we are still using the platform, a virtual platform, to conduct a weekly management meeting, because I think this also can improve many things. We also thank to COVID, because of the COVID, there is a massive exponential digital acceleration of any platform in this. For example, Zoom, you can see Zoom now become, owners of the Zoom become billionaires. So you can see that how people can use the crisis of COVID-19 change into the opportunity. So in conclusion, Chairperson and ladies and gentlemen, COVID-19 and research in Malaysia, we have seen that COVID-19 has really changed the way we do almost everything. I want to repeat here, every sector is a health sector. Whether you want to fly anywhere, you have to document your vaccination, you have to be wearing all this and that. And it is much more than a health crisis. And it is also affecting many other aspects, as I said to you early on, not only the medical, but also a social economic crisis is a real thing that how COVID-19 caused to us. And COVID also teach us how to adapt with the technologies for not only communication, in teaching, learning, in research, in services, clinical and non-clinical services. And really, there is no boundary among research teams around the world. That is the lesson for the COVID-19 pandemic for all of us. With that, I thank you so much for your attention. Again, may I congratulate to all of you for successfully organizing this International Postgraduate Research Conference. And I'm delighted as a part from the medical faculties to potentially collaborate in many aspects with all of you clever, brilliant social scientists to work with us. With that, thank you so much and have a nice day. Assalamualaikum warahmatullahi wabarakatuh.